Assalamualaikum warahmatullahi wabarakatuh. Hello guys, I'm Rosenna Gitania. You can call me Gita. I'm a student at the Medical Education Study Program, Faculty of Medicine and Health Education, Bengkulu University, 2021. So in this seminar, I would like to talk about the impact of COVID-19 on tuberculosis case detection and treatment outcomes in Sierra Leone. So before we talk about that, I want to ask you, do you know where is the Sierra Leone? Well, Sierra Leone is in the West Africa. So what is the connection between COVID-19, tuberculosis, and Sierra Leone? We're going to talk about this in 5 parts. The first part is introduction. The second is aim. Third is material and methods. Fourth, result. And 5 is conclusion. We're going to start from the introduction. Since the outbreak of the coronavirus in December 2019, millions of deaths and burdens on the healthcare system have occurred all over the world. In dealing with this crisis, several countries are implementing whole population lockdowns as a broader virus control strategy, including sub-Saharan Africa. However, the impact of COVID-19 pandemic in this region and elsewhere in the global south is still difficult to assess. Apart from COVID-19, the main unintended consequence of this lockdown is a severe disruption in the continent's response to a tuberculosis epidemic. Sierra Leone is a high-burden tuberculosis country in West Africa with a tuberculosis incidence rate of 295 per 100,000 population in 2019. According to a recent report by the World Health Organization, an assessed 1.4 million more cases of tuberculosis go undetected and untreated. By 2020, with a 21% diminish from 2019, which is anticipated to include 500,000 tuberculosis patients by 2020. The National Tuberculosis and Leprosy Control Programs of the Ministry of Health and Sanitation of Sierra Leone offers treatment to all people diagnosed with tuberculosis in 170 centers in the country with subsidizing and technical support given by the Global Fund and other partner agencies. In response to this pandemic, the government of Sierra Leone announced a state of crisis and executed lockdowns beginning from April through June 2020. These activities needed the reconfiguration of the prevailing models of tuberculosis care delivery. Particularly, these changes took the frame of diminishments within the frequency of clinic visits. To play down the chains of COVID-19 introduction and exchanging from specifically directly observed theory, or DOT, the traditional model of tuberculosis treatment delivery in this setting, to once monthly dispensing of anti-tuberculosis drugs for self-treatment at home. The recent data analysis embraced by the World Health Organization has provided some perception into the impact of the lockdowns on tuberculosis care delivery in Sierra Leone. In 2020, there were an estimated 2,000 less tuberculosis notices countrywide, an 11.3% diminish from 2019. However, the full effects of the pandemic on tuberculosis care in the country remain uncertain. So in this study, we aim to examine the impact of COVID-19 pandemic on tuberculosis case detection and treatment outcomes at the largest tuberculosis treatment center in Sierra Leone. Next, here are the materials and methods that are used in this research. The first one, the study design that is used in this research is a retrospective study setting at the chest clinic at Knopf Hospital in Sierra Leone during 2019 and 2020. The population is patient of all ages. Demographic and clinical data were extracted from the medical records of clinic. Besides that, defining the terms used such as presumptive tuberculosis, laboratory confirmed tuberculosis, and so on. Clinical procedures are starting from self-reporting, diagnosis of active tuberculosis, and the last is anti-tuberculosis treatment. Third, The configuration of tuberculosis delivery services in Sierra Leone during COVID-19 pandemic. 4. Setting time points and period. The study used 2019 as the pre-COVID-19 period and 2020 as the intra-COVID-19 period. For comparison, the pre-COVID-19 period was further divided into quarter 1, quarter 2, and quarter 3 respectively from 2019, whereas the intra-COVID-19 period is considered as the corresponding quarter in 2020. And fifth, research question. There are two questions in this research. The first one is, what was the impact of COVID-19 pandemic on tuberculosis case detection, referrals for tuberculosis testing, and laboratory confirmed tuberculosis case notification at the chest clinic at Knopf Hospital in Freetown, Sierra Leone? Second is, how did tuberculosis treatment outcomes compare between patients using self-administration of anti-tuberculosis medication at home during April to June of 2020 versus patients using clinic-based DOT during April to June of 2019? 6. Statistical analysis used SPSS Barrie 27.0. 7. Ethical consideration. Ethics approval was obtained from the Sierra Leone Ethics and Scientific Review Committee. Approval date 10 December 2020. Next, here are the results. The first one, we're going to talk about comparison of presumptive and laboratory confirmed tuberculosis cases during the pre and intra-COVID-19 periods. So guys, take a look at the table. There was a decrease in tuberculosis referrals. Based on the display, a total of 2,300 referrals for tuberculosis testing in 2020 compared with 2,636 in 2019, representing a 12.7% decrease. Reductions also happened between males and females, 2.3% versus 24.9% respectively, and between children and adults, 19.6% versus 12.3% respectively. A decline community-initiated referrals for tuberculosis testing as much as 81.3%, whereas self-reporting and health facility-initiated referrals have 7.7% and 46.6% increases respectively in 2020 compared with 2019. In spite of this decrease in presumptive cases during quarter 1 to quarter 3 of 2019, there were 733 laboratory confirmed tuberculosis cases compared with 535 laboratory confirmed tuberculosis cases in 2019, representing a 37% increase. Besides that, HIV positivity rate was 31.9% in 2019 and 33.9% in 2020, representing a 2% increase. So guys, take a look on figure 1. Based on figure 1, there was 25% increase in referrals during the first quarter of 2020 compared with 2019. During the second quarter of 2020, there was a 57% reduction in referrals due to the lockdown in 2020. The lockdown was loosened at the start of July 2020, and by the end of the third quarter of 2020, referrals for tuberculosis testing had improved by an 8.2% decrease and were approaching 2019 figures. Based on figure 2, there were more tuberculosis referrals amid the primary quarter of 2020 and 2019. Month-to-month referrals diminished significantly from July of 2020, with the months of April and May 2020 encountering the foremost abrupt drops, 73.5% and 67.2% from the comparing month-to-month referrals in 2019. Essentially, laboratory confirmed cases expanded by 37% by and large in 2020 compared with 2019. However, the lockdown saw diminishes of 60 of 60% and 35% in laboratory confirmed cases in April and May 2020, compared with the same months in 2019. The second result, we're going to talk about the comparison tuberculosis treatment outcomes during the pre and intra-COVID-19 periods. Table 2 compares the characteristic and treatment outcomes of patients who completed tuberculosis treatment during April to June of 2019 and 2020. There was no differences in the distribution of gender, age, patient type of tuberculosis, or HIV status between the two groups. There were significantly more laboratory confirmed tuberculosis cases, 359, as much as 29.7% patients who completed treatment during the intra-COVID-19 period, April to June 2020, did so by means of self-administration through monthly dispensing. Overall, there was a higher tuberculosis treatment success rate among patients completing treatment during April to June of 2020, 55.6% versus 46.7%, with lower rates of loss to follow-up 16.3% versus 21.3%, and death 8.9% versus 17.8%. compared with parents completing treatment during April to June of 2019, pre-COVID-19. Next, the third result, we're going to talk about predictors of tuberculosis treatment success during the pre- and intra-COVID-19 periods. So, multivariate regression analysis on table 3, new tuberculosis diagnosis versus relapse, pulmonary tuberculosis versus extrapulmonary, HIV negative status, and self-administration of anti-tuberculosis drugs through monthly dispensing versus clinic-based DOT independently predicted treatment success. Next, conclusion. In conclusion, COVID-19 pandemic negatively impacted tuberculosis care delivery at the largest treatment center in Sierra Leone, with fewer presumptive cases referred to testing in 2020 compared to 2019. Notwithstanding, treatment success rates were higher in 2020. Among others, self-administration of anti-tuberculosis drugs independently predicted treatment success, a finding that may have policy implications for tuberculosis control efforts in this high-burden country. More resources are needed to strengthen essential tuberculosis services to help reverse the negative impact of the COVID-19 pandemic on tuberculosis program activities in Sierra Leone. So this is the source of the material. Okay, guys, I think that's all from me. Thank you for your attention. And last, I would like to say thank you. Wassalamualaikum warahmatullahi wabarakatuh.